This isn't about heavy weights or barbells. It's just about being able to put your body through work and having it respond favorably to that.
We're back with you on the Dr. Nandi Show. Now, we've been talking about human longevity and some ideas and strategies for extending it. Now, my next guest is a naturopathic doctor and chiropractor who thinks that maybe she's found a magic bullet for aging. And it's not as complicated as you may imagine. Please welcome Dr. Tyna Moore to the show. Dr. Moore, thank you.
Thank you so much for having me.
Of course. And tell us about, you had your own personal, adventure, let's say, with this. Tell me all about that.
Well, I grew up in Southern California, and I sort of strived my entire life to be as thin as possible. That was the way to be. That seemed to be the healthy way, and do lots of cardio to get there. And I found myself in my 30s with really low bone density. Metabolically, my labs were a bit of a mess, and I just really wasn't feeling well at all. And I realized that I was suffering from what's called skinny fat, where you
Skinny fat?
Skinny fat. It's where you you might be small in size, but metabolically you're looking much like a pre-diabetic. So I actually started doing some research because I'm my own guinea pig, and I found—
You're a research junkie, huh?
I am. And I found strength training. I found adding muscle mass to my body, strength training, that seemed to be scientifically what was the quickest route and also the most efficient way to spend my time at the gym. I don't want to spend hours at the gym.
Yeah.
So, 20 minutes a couple times a week, I thought, sure, I'll try it. And a few years later, the results are amazing. I've been using this with my patients, and
you felt better too.
Oh, so much better.
Did you change what you ate as well?
I ate more. To be honest, I had suffered from being a low eater.
Because you wanted to be skinny. That was the whole thing, eat as little as possible. And there's so many, this is so important because so many people, men and women, all they care about is how they look in that mirror. And you don't have x-ray vision, nor do you have the test that she has, so you may not know what's going on the inside. And many of your patients now, and your patients have hip fractures, I have my notes. And so how serious are these for elderly people?
So what most people don't realize is that when you reach your 30s and 40s, you start to lose about 8% of your muscle mass per year. And that accelerates rapidly as you get older. The other part that happens is that muscle gets replaced with fat. And so what happens for most elderly folks is they're walking around thinking they're the same size, but they're mostly fatty muscle now. And that muscle is weak, and those bones are weak. With the muscle loss comes the bone loss. And so often patients will find or people that are aging will find themselves weak, low stamina, and hip fractures are unfortunately very common and quite deadly.
Absolutely, and I'm glad you said that. It starts with a hip fracture, you go in the hospital, and is often the beginning of a horrible existence after that. So, what she's going to tell us now is the exercise that you can really do to make that happen. And again, please listen carefully because so many of my patients have been decimated by these fractures. So what exercises would you say are ones you'd recommend? And then maybe also speak about the metabolically expensive exercises versus others that are not.
Okay, so first off, I would say we need to get rid of the idea of chronic cardio. Running, cycling, doing cardio until you're blue in the face, all that does is make you better at cardio. When you build muscle, you build stamina and you get better at everything. So you have more control, you have better balance, and you want to work the big muscle groups. So it's not about vanity, it's not about abs, it's not about big arms, it's about working the big muscle groups. So the glutes, the legs, the lower body, that's where you get the most metabolic bang for your buck. So those muscles will really give you the health benefits that I'm talking about. So things like squats, deadlifts, which is a simple hip hinge exercise. If you look at any society in the world, as women work in fields and as people work on the ground agriculturally, they hip hinge.
That's right.
Naturally. So those are the big, when you're pulling a bag of potatoes out of the corner or you're pulling something that's heavy, you want to be able to hip hinge in an effective way so you don't hurt your low back. So squats, deadlifts, or a hip hinge movement, and then I think everybody should be able to push their body weight off the ground. So working towards maintaining a push-up, which most people can't do as they get older.
Absolutely.
But if you can't do a push-up, you can't push things off of you. And I recently had a terrible fall, and I caught myself in a push-up. And I think my face would have been, I would have lost teeth on that one had I not had that ability to push out of it. So this translates, strength training translates into everyday life and safety.
Absolutely. And so many older folks are following, and you're absolutely right. If they're able to support themselves a little bit, there could be so much less damage. Now, people don't usually, think of older folks doing the kind of exercises you're talking about. But they do, don't they? I mean, when you recommend it to them, and listen, you know, you don't have to, you know, do the same exercise as a 20-year-old,
No.
but are they accepting of it, your patients, when you tell them to do this?
They are, and I have women reaching out to me from all over the world who are in their 70s and 80s who are now squatting and deadlifting and doing these exercises. And you don't have to do huge amounts of weight. This is about training for life and longevity. And so just being able to pick up heavy things and move them around is so good for your central nervous system, so good for your balance and your control and your strength and stamina. This isn't about heavy weights or barbells. It's just about, you know, being able to put your body through work and having it respond favorably to that.
This is really important information. And if people need to know more about you, how can they get hold of you?
My website is a great place to find me.
What is your website?
It's drtyna.com, and it's spelled interestingly. It's
T-Y-N-A.
T-Y-N-A. So,
Thank you so much for coming up.
Thank you,
So
sir.
appreciate it.
Hi everyone, I'm Dr. Partha Nandi, and if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.